Every tooth actually has a hollow core, and that hollow core contains the nerve and the blood vessels that supply that tooth. Now, if you get a cavity and the cavity works its way, cavity is like a rotten apple. As the cavity approaches that hollow core, it can infect the nerve and cause a toothache, what we call pulpitis. The tooth can be sensitive to hot, cold, a throbbing pain. And these are usually an indication of a root canal. And what we would do is we'd go in and remove the cavity, and we would also broach into that hollow space that contains the nerve. We would basically remove the nerve, clean out that hollow space that holds the nerve, disinfect it, and then we would fill it with a biologically inert material called gutta percha. And once that's sealed and the bone is healthy around the tooth, more often than not, that will require a crown because the tooth will have a tendency to dry out and become brittle. So to protect the tooth, we'll put a crown on it. Root canals come in many different flavors, and people would walk in here where they've ignored the situation for a period of time. They'll come in all swollen, and then it's a matter of putting them on an antibiotic. Sometimes there's a visible abscess that needs to be removed, like lancing a boil. These are the severe cases. If you catch it early enough where it's just, okay, it's throbbing now, it's only been going on for a couple days, you can get it in there before the problem works its way into the bone, where the problem is just contained within the tooth. If we can do the root canal at that point, that's great. But a lot of people, they'll try to avoid the root canal, and what that does is it basically kicks the can down the road, and it becomes a bigger, more painful, and more expensive process.